Good evening, everyone. Welcome back, or welcome if it's your first time. If it is not your first webinar, then you know the drill. If it is your first webinar, then my name's Dr. Edmund Farrer. I'm an ex-military doctor. I have tinnitus myself, and I'm also the founder of Otto. So I've got with me here this evening Dr. Joseph Salem, who is an NHS doctor working at the forefront of health, currently working in ENT. And Joe has growing experience in ENT actually now. Joe, welcome. Thanks for joining us. It'd be great if you could just give us a quick introduction and let everyone know who you are, what you've done work with, and your relationship with tinnitus.
Of course. So my name's Dr. Joseph Salem. I've been working in the NHS now for just over 4 years and have worked in a number of different areas, but specifically within ENT, both before and now. I have a particular interest in tinnitus and myself have tinnitus, so I can understand the difficulties that people have when they're going about their daily lives without ringing in their ears. And I think having seen it a lot in my practice, both kind of in emergency situations and also kind of in clinics, I think it's something that we really need to talk more about.
Thank you, Joe, for the introduction. So the topic of today's webinar is, we've kept it quite broad and general. Dr. Salem is going to talk primarily about tinnitus research and the role of ENT with tinnitus. So how we're going to do this, we're going to have a discussion about tinnitus research, have a general Q&A with me. And then further on the line, you are all going to get an opportunity to ask your questions to Dr. Salem directly. So if you have any questions about anything we're talking about, just head over to the Q&A, put them in the Q&A, and I will get around to them at the end. I know, actually, thank you for those of you that have submitted your questions already. We've got a few questions, so the people that have submitted their questions already will get priority. We'll go through those first, but if you do have any questions, please put them in the chat. Okay, Joe, let's dive straight in. I think what a lot of people will want to hear about is the current state of research in tinnitus. Could you give us an overview of what's happening, what's going on in the world with tinnitus research? I'd love to hear to get started with that.
Of course, I can. So there's lots of different types of research looking into tinnitus, as you can imagine, at the moment. And you can kind of split these into different things. So you've got the causes of tinnitus. So why is it that people get this ringing in their ear that only they can kind of hear? Research looking into treatments that we know work and how effective they are and how we can make them more effective. Research looking into new treatments, which I know is a hotly anticipated subject. And also more recently looking at the effect that tinnitus has on people's lives. And by that, I mean on their work, on their sleep, and on their general quality of life. Problem with all high quality research is things take time, especially in a condition which affects 1 in 7 people, a huge proportion of the population. And that means we need very, very large studies to ensure that these results are both precise and accurate. And we need to make sure that's the case, obviously, because it's going to affect such a large body of people. So current hot topics include understanding the effect of tinnitus on sleep. And this has specifically been focusing on kind of using body trackers and mattress trackers, as we're all wearing more kind of gadgets on ourselves, to understand how tinnitus is affecting sleep, but more importantly, how sleep is affecting tinnitus. There's a huge number of other areas, including treatments that we can go into a little bit later, but mainly it's on quality of life. It's what can we do as kind of the medical professionals to improve people with tinnitus lives.
Thanks, Joe. So I suppose there's so many different things that we can be doing research into. There's so many different areas that we can be looking into. The treatments, I mean, of course, we don't fully understand in many cases why tinnitus happens, do we? And then, of course, the impact it can have on our life. So it very much depends on what's the specific kind of part of research. And so the next kind of question I wanted to ask about was just zooming in actually on the new treatments aspects. And I think many people here will want to hear about what's on the horizon. What's looking really promising at the moment for tinnitus? Is there anything looking promising? What can we expect over the next 5-10 years?
Yeah, of course. So I think understandably, this is a question that comes up often. And it's because, there hasn't been that one size fits all golden treatment that can instantly help everyone with tinnitus. And so again, we can kind of split what's being explored in the research into different areas. So there's lots of research looking into sound therapy and sound notching, which I know has been evaluated kind of over the past 10 years. And whilst there isn't any clear evidence to show that it improves people's tinnitus, it can improve people's quality of life. There's also some exciting work looking into things like bimodal stimulation. So there's some specific devices out there where people are having electrical stimulation either into the back of their ears or to their tongue whilst getting sound therapy. The research with those, it's varied due to the fact that they need to ensure they've got a high number of patients that are being looked into. And also when you actually kind of dig down into some of the studies, it's making sure that the results are applicable to the largest number of tinnitus sufferers. We can focus on a specific group, but that doesn't mean that result is necessarily going to be a treatment that everyone can use. But that's not to say that there's not really exciting opportunities out there. So some really interesting trials are looking into how we can use a known treatment, such as cognitive behavioral therapy, to be used more digitally, so people can access that wherever they are, irrespective of where their audiological center is. One of the main issues I have when I'm looking after patients is if people are not based near a big tertiary or big kind of audiological or ENT center, the services that they access are far away. And as a result, the likelihood of them getting high quality CBT or TRT is low. And kind of finally amongst that, another exciting area is the idea of how quickly we can habituate people. So habituation, for those who don't know, is this kind of how quickly we can tune out that tinnitus sound by retraining our brain. And there's some really exciting studies looking into both how different treatments can do that. And I'm sure some of you will also be looking into kind of the more medical either injections or pills, those quick fixes. And I think, unfortunately, at the moment, whilst there's still a huge amount of research going into those sorts of areas, there's no one, golden ticket that's really shouting out at the moment. But it's an area that's hotly anticipated to kind of kick off over the next 5 to 10 years with more research that's going through.
Thanks, Joe. Yeah, and I think I've certainly been quite excited by some of these, they call them neuromodulation treatments for tinnitus. But what I'm hearing is that the reason why there's slow progress here is because they haven't got enough people into the studies to get a representative answer. And the studies have been relatively small. Is that right?
Yeah. So, with these sorts of things, they're new. So the treatment itself can be expensive, which means getting the funding can be difficult. Also making sure that it's safe, it has to go through a number of smaller clinical trials before it really starts to affect the larger groups. It sounds like they're making really good progress in certain elements with this. But I guess the other issue with all sorts of trials is making sure the people that are going into the trial are representative of everyone who's got tinnitus or nearly, the general population, given the fact that it's so prevalent, with 1 in 7 people having tinnitus to some form.
Yeah, and that's so relevant. If you think we've got 58 people here, there will be such a wide ranges of types of tinnitus, people's experiences of tinnitus, causes of tinnitus. So it's important to get that representation.
Exactly.
Okay, so one thing I would like to ask about now is alternative therapies. So alternative therapies, such as one thing we get asked about a lot actually is things like acupuncture or herbal supplements, or perhaps something like homeopathy. Is there any evidence to suggest that any of these alternative therapies are effective in treating tinnitus?
So there's no current high quality evidence suggests that those alternative treatments are effective for tinnitus. Now, I know there have been some trials looking into specific herbal supplements, looking into acupuncture, as you say, homeopathy, but none of them have shown what we would call significant results that they are effective. We know that everyone will have someone that they've heard of or known who's had a single treatment that's improved their tinnitus, and that is multifactorial. And unfortunately, the evidence doesn't suggest that we can prove those specific causes. I think it's important to say that there will be some things like massage or acupuncture that may help in other areas of people's lives, such as stress. And we know there's a strong relationship between your mood, your stress levels, and possibly your tinnitus. And so that might be where people are getting some of their benefit for. But I think it's important to say that using alternative therapies that may cause possibly a harm to yourself would not be recommended.
Yeah. I'd just like to point everyone out, if you do find something online that is claiming to be a cure for tinnitus, or is claiming to be a quick fix, is probably too good to be true. Head over to the Tinnitus UK website. That's the UK Tinnitus charity, and they have a traffic light system for assessing the both how effective a treatment is and how safe a treatment is. Green, amber, and red. And if you head over there, it will give you whether something's safe and effective. One other thing we get asked about a lot, Joe, and something I'd really love to hear your thoughts on as a doctor with a lot of experience in ENT, is about the link between the COVID vaccine and tinnitus. What's the research showing currently? Because I know this is quite a fast evolving area.
Yeah,
What's the research showing? What's the research currently showing about whether COVID vaccine could cause or even exacerbate tinnitus?
So, I mean, as you say, often when I'm in clinic, people are asking this question, given the effect that COVID has had on our life. And I think to understand it kind of truly, or to help explain it, it's best to kind of look at it as a whole. So we know there's a few reasons as to why at least COVID-19 and tinnitus may have some level of association. Now, the first is due to the actual way that we believe that tinnitus might be caused in some people. And that's through possibly a virus that we know can cause inflammation, leading to inflammation of some of the nerves that supply either your hearing or your balance or other nerves around your body. There's some suggestion that that might be causing these tinnitus or ringing sounds that people are getting. Now, we know that COVID was a virus, and as a result, it would be expected, or at least partially expected, that that COVID virus may have caused some inflammation in some groups of people in those areas. And that's why there's been an increase in tinnitus, because there's been a high proportion of people having a very significant virus in their body. And actually, there's been a recent study up at the University of Manchester in the UK that showed of people who were hospitalized with tinnitus, who were asked whether they, hospitalized with COVID, who were asked if they had tinnitus. I think about 6.5% felt that their tinnitus symptoms had worsened. So there definitely is some evidence that there's correlation. But I think it's important to note that doesn't mean that there is causation. So we also know that tinnitus can be affected by people's mental health, especially anxiety and stress. And we all know that COVID affected everyone hugely in terms of this. You know, I was working in hospital and seeing people come in with the symptoms that they were, it's scary for everyone. And it's a time of high anxiety, you know, wherever you were in the world. And given that we know how the vicious cycle can work within tinnitus, where you're stressed, you pick up your symptoms more, and then you notice your symptoms more, and you attach those negative emotions, it would be understandable that more people started having flares in their tinnitus due to their mood and their kind of mental health during that very difficult time. I think
Right. So,
actually,
sorry, Joe.
finally, just to say is that also we have to think about the other things that changed during that period of time. So we were working a lot more at home. Now, some people's homes will be noisier or quieter than back in the office, but in the office there's usually bleeping, there's usually printer noises, computer noises, and that can act as almost like a natural masker for people's tinnitus. So suddenly when you're at home, you then start to realize that you're hearing this sound, and as a result, there's almost a kind of pickup in people realizing of the sound they had. But I think it's important to note that if you look at the research and you look at the extensive work that's been done, there is no link between the COVID vaccine and tinnitus. And this has been closely monitored through things like the MHRA's yellow card scheme, which is specific for reporting these sorts of concerns when a new treatment or vaccine is placed. And there's been no evidence to suggest that those two things are correlated.
That's fascinating. And it's really interesting to hear that although there is the levels of kind of COVID and levels of tinnitus, reported tinnitus are increasing at the same time, doesn't necessarily mean they're linked. And I hadn't thought about it from that perspective before, especially people working from home, being in more quieter environments and being more aware of their tinnitus. But I'm sure everyone else here resonates with when they're stressed, when they're tired, perhaps when they're ill, their tinnitus sounds worse, which would, of course, mean that people are more aware of their tinnitus seems louder. So yeah, that's a really, really interesting insight. Yeah, thanks for that, Joe.
And I think
Okay. Yeah, go on.
Alongside that, there's
Yeah.
Before COVID, you know, the amount of digital work that we did in kind of medicine, at least in the UK, was relatively limited to some extent. And so actually access to services was typically quite difficult, especially for things like tinnitus retraining or CBT. And I think since that time, there's now been a huge kind of pivot towards trying to deliver more digital services within the tinnitus area. And so I think it's quite an exciting area to be looking into.
Yeah, it shows a lot of promise, I think. Okay, so another question that we get asked really regularly, and I think we'd love to hear your thoughts on, is surrounding the link between tinnitus and dementia. And I think every webinar we've had over the past kind of couple of months, someone has asked the question, does tinnitus cause dementia? Does tinnitus cause cognitive decline? What's going on here? Is there any evidence to suggest that tinnitus could cause dementia or could be an early indicator? What's going on with this?
So I think this is a difficult question to answer, and the reason for that is due to something that we call in the medical community kind of confounders. So there's lots of different reasons that interlink cognitive decline, tinnitus, and dementia, and I'll try and explain them here. So we know that hearing loss is associated with tinnitus. We know I think about 80 to 85% of people with hearing loss will also have tinnitus. We also know as you get older, your risk of age-related hearing loss, which is completely normal, also increases. So you'd expect the older population to have a higher proportion of tinnitus. We also know that as you get older, your prevalence or likelihood of getting dementia increases. And as you can see, there's almost a little triangle where these three things could look like they're very much related. And what the research is currently trying to do is to look to see what causes what and whether there is this causative or one causing another between those three. Now, I think it's important to say that when you look at the evidence currently, there's no evidence to suggest that tinnitus is an early indicator from the research that's been done. But there is large studies going on at the moment to try and better understand that relationship as to whether tinnitus or cognitive decline could be linked. But from my understanding so far, there isn't a large body of evidence towards that.
Okay, I think that will be reassuring for many people here to hear that is then because it's obviously tinnitus, hearing loss, very closely linked, hearing loss, dementia, closely linked. You'd think that there could be a link, but it's reassuring to hear that the evidence says, well, there's no convincing evidence yet to show that the two are linked. So I'm going to ask two more questions actually before we go on to the audience Q&A. And the next question I want to ask is about actually your experience speaking to patients with tinnitus. And it sounds like you've obviously spoken to quite a few people with tinnitus. You've seen a lot of patients with tinnitus in your clinic. What are the most common misconceptions people have about tinnitus that you encounter in your work? And perhaps maybe not just from a patient perspective, but also from a professional perspective as well, with the doctors or the other ENTs or the GPs that you speak to.
I think it's a really interesting question because I think, as you say, both for patients and for professionals, tinnitus is not particularly well known about. We don't know the exact causes. It's not like certain heart conditions, and the treatments are kind of developing and have been developing over kind of the past 5 to 10 years with clear bodies of evidence. And so the two main misconceptions I'd say I get are, one, from a patient perspective, which is, am I ever going to get rid of this? And the second, both from a kind of a patient and a medical professional perspective, is about the types of treatment that we give. So tinnitus is clearly a very difficult condition to manage. And at the moment, we don't always do the best job at being able to manage people with the kind of individual symptoms that they have. And that's because it's hidden. That's because often professionals can't hear what the patient is hearing. And there's that misunderstanding between the two. Given that patients with tinnitus can hear tinnitus sometimes all the time, daily, weekly, monthly, whenever it is, understandably, there's anxiety of, will I ever be able to get rid of it? And that intensity can really affect your sleep, your work, your quality of life, how you interact with people. And so what's then interesting is when you then say to someone, actually, there is a way to try and reduce your tinnitus. And yes, it affects everyone slightly differently, but things like habituation and through cognitive behavioral therapy, you can really improve people's tinnitus, sometimes in quite a short space of time when delivered effectively. And so that can really take people back when you say to them, actually, you're not going to hear this forever. And that kind of brings me on to the second misconception, which is the treatment. And so, yes, there's lots of different treatments that are used that aren't necessarily backed by a body of evidence, but there are certain ones like CBT, so cognitive behavioral therapy, and hearing aids or sound amplifiers for people who have got hearing loss that are shown to improve. And so when you say to someone that cognitive behavioral therapy, a therapy that's typically used or at least well known in certain mental health conditions, can stop you hearing a physical sound that you may be hearing every single day, people are very surprised. And also people can be quite taken aback and almost don't believe you that that's the way that you can treat something. And I think it's breaking through that misconception and giving people the clear evidence and education that structured CBT can really lead to a huge improvement in their symptoms. And I think especially when you see people who have tried it and afterwards, typically the people's, you can see on their faces they've completely changed in how they react and interact with that tinnitus.
I would just can't, emphasize enough how much I agree with that, especially with my experience of talking to people that we've worked with at Otto. Often CBT, people don't necessarily believe, how could that work for tinnitus? How could that be effective? But then when they've tried it, maybe 3 or 4 months down the line, perhaps even 1 or 2 months down the line, and they're not noticing their tinnitus seems quieter. Their tinnitus no longer has an impact on their life. It's amazing to see. And often the feedback we get is, I wish I'd tried this earlier. I wish I'd found out about this earlier. And it's actually a shame that CBT is so difficult to get access to. And it's so difficult for people, especially here in the UK and I think in the US as well. It's so difficult for there's just not that many places that provide CBT for tinnitus. Okay, we're going to go. Thank you, Jay. That was really, really insightful. Great discussion. We're going to continue the discussion now with the audience Q&A. So thank you for those of you that have submitted questions. I'm going to do the email submitted questions first. So really good question here from Jenny. And Jenny's asking about the research into whether noise cancelling, so she said noise cancelling aids, I presume she's talking about hearing aids, noise cancelling hearing aids can be tuned in to successfully cancel out a person's tinnitus. So perhaps noise cancelling headphones, I think Jenny's talking about. Do we know whether noise cancelling headphones can cancel out someone's tinnitus? Is there any research there that you're aware of?
So I think noise cancelling headphones have really only been developed effectively over the past kind of 5 to 6 years. And so there is this body of interest, at least, into whether noise cancelling headphones can actually reduce the amount of loud sounds that you can get that we know can affect tinnitus, which is obviously would be a great thing, especially given the use of very loud music that we're having amongst the younger population. And then in terms of kind of matching it, I mean, we know that notching is a sound therapy technique that people use. The evidence isn't that strong in terms of it being an effective use for everyone with tinnitus. And so I know that there will be studies going on looking into whether that can be more effective with things like noise cancelling headphones. So it's something that's being looked into, but I'm not aware of any kind of new breakthroughs in that area.
Got it. So we've got a question here from Darren. So Darren's asking about different noises you can hear. Is it normal for the tinnitus noises that you hear to change, particularly as we get older?
So tinnitus, I mean, I'm sure if I asked everyone here on this webinar, can you sing or describe your tinnitus sound, it would be completely different. And I'm sure if we all did it together, it would be an interesting sort of orchestra. But what I'd say is it's very normal for those things to change. Some people will have tinnitus that stays the same sound, they hear the same few notes. And as long as they're not concerned, that's what they hear. For other people, they hear a popping sound or almost like a squidging sound, and it's different for everyone. Also important to note that people will have changes when they're moving their jaw, when they're going up in planes, etc. Their tinnitus will adapt, and it can adapt as we get older. I think the things, to be really concerned of are that kind of pulsatile tinnitus, or if your tinnitus is only in one ear, or is associated with any of the kind of more red flag symptoms. They're the ones that we get more worried about. But in terms of your kind of normal tinnitus maybe varying a little bit, that can be considered quite normal.
Thanks, Joe. We got a question here from Jeff, and Jeff's asking about TMJ related tinnitus issues. Are you aware of, and I appreciate we might run into the same problem as the previous question, but are you aware of any good treatments for tinnitus that's related to TMJ? And I do appreciate that TMJ is more of a question to perhaps ask a dentist. But is there anything you're aware of that could be helpful for TMJ causing tinnitus, or TMJ related tinnitus?
So again, this is actually quite an interesting area of research that's going on at the moment. People are looking at whether certain levels of stimulus to that area, tongue, TMJ, might improve people's tinnitus who have that specific kind of subset of tinnitus, because obviously not everyone with tinnitus does get those TMJ symptoms. I mean, in the kind of body of evidence to suggest that TMJ can affect your tinnitus is things like exercises, bringing very light stretches, etc. They've shown some improvement in groups of people who do have those symptoms alongside their tinnitus. In terms of kind of the growing research body, as I said, there's lots of new stimulation devices that are coming out looking into that area, but again, none that have been approved as showing a kind of a significant efficacy for tinnitus.
Got it. Question here from Mary. So Mary is asking about things that you can do to get back to work with tinnitus. Sounds like Mary's had a difficult time with her tinnitus, and it's been difficult to focus at work. Do you have any advice or general advice? I appreciate you can't offer specific advice here, but do you have any general advice for people that might want to be able to work effectively with their tinnitus without their tinnitus being too intrusive?
Of course. I mean, I'm sorry to hear for anyone who's having, tinnitus that's affecting them every single day and affecting their kind of quality of life and their work and their sleep. I know it's a really, really difficult time. And I think there are different ways that you can try and manage that. And I'd say this, I can't give any specific medical advice, but kind of generally, I'd say it's all good having a bit of a structured plan about how you might go about this. So first of all, the things that we know work. So we know that CBT is a really effective treatment. And we know that if you have any hearing loss, sound amplification or hearing aids can also benefit. So I'd say look at those two as the things that you're going to try and keep constant through this period of time. And then there are other things that can improve your quality of life. So we know that sound masking in the background, so having a fan on, having music playing or anything like that, even those generated sounds like bird song, can improve you not hearing your tinnitus so often. And that can make things like work and sleep feel more manageable. And that, as you're working through with your CBT, can really improve your journey towards becoming habituated. But I know it's not easy.
So, question from Susan. Thank you to everyone, by the way, that submitted the questions via email. So we're going on to the live questions now. We'll try and get through these quickly. So Susan's asking, could microsuction, ear microsuction, help with tinnitus? Perhaps it'd be good to explain what ear microsuction is, and then does this help with tinnitus?
Of course. So microsuction, it's something that we very commonly do in ENT, and we do that when we're looking inside the ear. You have your outer ear, and then you have your canal that goes towards your tympanic membrane. And I won't get into the anatomy of it, but that kind of canal is where your wax is produced and kind of cleans your ear canal, and then can sometimes get built up. Now, there will be some people who actually have their tinnitus symptoms because wax has built up in a way and has either clogged up part of their ear canal, and for whatever reasons, what we don't quite know, they get this ringing sensation. As a result, typically, if you're seeing someone like an audiologist or an ENT, they may choose to look in your ear. And if they spot a large body of wax that looks like it's not being cleared properly, there's something called microsuction, where you use almost like a tiny little sucker, which you very carefully use to remove the wax. And it is quite a delicate procedure and needs to be done by trained individuals. Now, the removal of that wax might improve your tinnitus, but I would also say that one of the complications, at least, of microsuction is that you can also have tinnitus afterwards. And the reason for that is because you're having a kind of a almost like a tiny vacuum. I mean, it's absolutely tiny, but it's going very close to a very delicate structure in your ear. And even just the gentle pressure of the air pulling on the wax can affect your tympanic membrane and the tiny little bones inside your middle ear. And as a result, it can both improve your tinnitus if you have wax that's building up, but I think it's also important to note that it can cause short-term or mid-term tinnitus as well.
As unfortunately with so many of these questions, it's difficult to give a straight answer. And it's just impossible because there's so many different things that can happen. There's so many variables at play, isn't there?
Exactly.
Fabio, thank you for the question. So Fabio's asking, do you have any experience with patients that have changes in their perception of tinnitus? So Fabio, his tinnitus is almost imperceptible one week, then can flare up and does fluctuate. So in experience with your patients, Joe, do people's tinnitus vary, and is that a good sign? Is that a bad sign? Do we know what's going on there?
Yeah. So again, often when I'm seeing patients with tinnitus, and especially patients that I've seen before, I'll see them in one clinic appointment and they'll be doing really well, and 6 months later, their tinnitus has flared up again, and they're having these weekly or monthly fluctuations. And again, it can be very, very normal for that to happen. And again, if we look at kind of why we get our tinnitus, we don't know the exact reasons why, but we do know there's a huge number of factors at play: stress, how we're doing at work, all these different things. Even the background noise you're having in your house. And so I think if you're finding that your tinnitus is really flaring up and down, I sometimes suggest to people and say, well, why don't you try and match, say, your mood or your stress levels kind of week to week, and generally see, is there an association between you having a particularly difficult week at work and your tinnitus being worse at the weekend? Or actually, do you find if you're a bit more relaxed and you've managed to do some exercise, your symptoms have improved?
And what I say as well, sometimes if your tinnitus perception is changing, that might be because you're habituating. That might be one of the early signs that you're actually tuning out your tinnitus. So that's in many cases, I would see that as a positive sign.
Sometimes,
but I do appreciate it could be difficult to manage. Yeah,
I have actually heard of some patients will come in where they'll go, my tinnitus has really improved over, say, the past couple of months, and then they'll come in with a flare. And one way of thinking about that is actually, well, your tinnitus has improved to the point where it was affecting you daily, then weekly, now monthly, and then suddenly you're having an unfortunate flare and you're hearing it daily again. Think of the number of days that you've not had that, the number of days where you haven't had your tinnitus, and think, well, actually, if I haven't had it for quite a few days and now I'm having it for a few days, that might be, as you say, Ed, that you are habituating and you're actually further through the process. And whilst that can be quite difficult to think about and it feels like you're going backwards, you very well might actually be exactly on the journey that you need to be.
Yeah. And it might be that instead of being one step forward, two step back, it's the other way around. Okay, so we're going to do a few quick fire questions here because I want to get through as many of these as possible. So Mary's asking, is there a drug that can help inflammation of the nerve due to COVID? So I'm presuming she's referring to what we talked about earlier.
Yep. So there's lots of different medications that we can give that generally reduce inflammation in the body. There's none that we would use in a situation like COVID-induced tinnitus that I'm aware of.
Question from Thanos. So Thanos is asking about tinnitus going away. Do you have any patient stories or cases that you know of just tinnitus going away? And if so, do you know why that happened?
So I can think of one case that I've actually had very recently, which was a young gentleman who had been had been to a gig, a music festival, lots of loud music, and had tinnitus thereafter, and was finding it really difficult. He didn't understand why he was having it. He didn't understand why it was affecting him on a near daily basis. Obviously, he came into a medical situation, so I treated him like I would with any of my tinnitus patients. But at the end of the consultation, having had no red flags, gave some really clear education of what tinnitus is. And actually, we gave him some digital CBT. And I just so happened to see him about 4 weeks later, and he was a completely changed man. He was so surprised at the improvement that he'd had not only in actual symptoms, but more in education and managing his own expectations, that this is something that he might have for a very long time and he might not have for a very long time. But being more aware of what it is, why it might happen, and also how we can treat it, had made his tinnitus go from, you know, a really difficult part of his life to something that he only noticed here and then. And for me, it was great to see something, you know, in a month. It's not the same for everyone. Sometimes it's a month, sometimes it's 6 months, sometimes it's a year, sometimes it's even longer. But seeing that people being on that journey was obviously, you know, hugely relieving for myself and for the patient.
Great story. Okay, a few more. So is there, question for Michael, is there any evidence that hearing aid use can reduce tinnitus?
So again, from the research that's out there, is for people who have hearing loss. So if you've had a specific pure tone audiometry that has shown hearing loss, we know that hearing aids can improve people's tinnitus perceptions. The reason for that, we're not quite sure. We believe it might be relating to the way that the brain's kind of linking up when you're kind of trying to reestablish those kind of neurological connections. But it's not clear exactly why, but we do know that they can help.
Got it. What's your opinion on the linear tinnitus relief device?
So again, this is a question that I'm often asked. It's very difficult for me to give kind of advice for individuals, but what I would say is I've reviewed some of the studies that's coming out, and again, it's small studies. They've been going through different clinical trials. There has been some reports of there being some significant improvements in certain individuals. But having reviewed parts of the trials, it's difficult to work out exactly which sorts of people with tinnitus have had improvements versus those who haven't. It's also a device that, you know, it's very early on in its clinical trial stage. It is picking up pace, and, you know, fingers crossed there are improvements all over this area. But yes, I'd say it shows some level of promise, but I think it's too early really to tell at this moment in time.
Thank you. So we're going to do one more question. That's from Jill. Have you found that eustachian tube disorder is common with tinnitus sufferers? And perhaps you could just briefly explain eustachian tube disorder.
Of course. So, the brief kind of summary of the anatomy of the ear. So your ear, you have your outer bit, you've got your ear canal, you've got your tympanic membrane, and then on the other side of that is what we call your middle ear, and that is where you have some bones that you use to kind of amplify the sound, that then get passed on to one of the nerves. It's what you hear, and in that area there's something called your eustachian tube, and that connects to your nose, and that's a way of kind of releasing any fluid that builds up or pressure that builds up. And that's why sometimes when you go up in an airplane, you get that popping sound, because it's the pressure in your middle ear kind of equalizing, and that's why you do it when you can kind of squeeze your nose. Now, eustachian tube dysfunction in ENT itself is also not particularly well understood. For some people, they get this crackling, this popping that sounds very much like tinnitus, but it might be more associated with rhinological or kind of nasal symptoms such as congestion. So I would say for my practice, I'd say I've seen people with eustachian tube dysfunction with tinnitus and those without. I wouldn't say there's a clear correlation for my personal practice. I'd also say that given the number of people who have tinnitus, I wouldn't be surprised if there's a large crossover. And I'm sure there's further work going into exactly eustachian tube dysfunction treatments, because there aren't a huge number of treatments for that in itself, alongside tinnitus.
Got it. Okay. Thank you so much, Joe. Really, really interesting insight. And I'm sure I'm speaking on behalf of everyone to say that I learned something new this evening. It's just great to have your insight as someone on the front line. For those of you that I didn't get around to answering your questions, I'm sorry. We've just had so many questions this evening. It's been a really popular webinar. So I'm sorry if I didn't get around to your questions. Dr. Salem, thank you very much for joining us this evening. It's been wonderful to hear from you. We do these every week, so please do remember to sign up next week. But otherwise, thank you, everyone. It's been great having you with us.